As the coronavirus continues to spread here in Northeast Wisconsin, tonight we show you what life is like for healthcare workers on the front lines. NBC 26's Ryan Curry introduces us to a ThedaCare nurse in Neenah working in the COVID-19 unit.
It's another day at work for Monica Bayer as she gears up to help patients battle the world's greatest enemy right now, COVID-19.
You read about and watch movies about pandemics and you never think it's going to happen until it actually happens to you.
Monica and I spoke off a Zoom video call and ThedaCare provided me footage of her working. She graduated in December and started working for ThedaCare at the beginning of the year.
I definitely did not foresee this happening in my first year of nursing.
She is covered head to toe in protective gear. An apron, a pair of gloves, and a mask are just some of the things she wears for a 12-hour shift. Days, she says, can get exhausting. How do you deal with the emotional stress that comes when caring for patients that have COVID-19?
The hardest part is when you hear a bed alarm go off or someone pulls their cord out of the wall and you hear that alarm, meaning they need help right now. The hardest part is not being able to just go rush in the room and help them right away. We have to make sure that we're taking care of ourselves first and putting on the proper PPE, making sure we have our little shields on, our cappers, our gown, our gloves.
She became a nurse because she was inspired by the ones who helped her family when her grandfather passed away. The hardest part of her current job is not being able to comfort families whose loved ones fight a virus that still poses many unknowns.
We don't allow visitors up there only for very special reasons like hospice and if they are negative for COVID.
Both Outagamie and Winnebago counties have a combined 80 cases of COVID-19. It's unclear how many are in the ICU. Bayer says she wants to give every patient she helps the same amount of comfort as the nurses who helped her grandfather.
I always try and look at the positives in the day. I truly don't think that you can go a day without saying anything positive hasn't happened to you.
She envisions one day soon she can walk through the halls of the ICU and see no patients with COVID-19.
Seeing the results come back and being able to tell the patients, the relief in their face is probably nothing like I've ever seen before.
Ryan Curry, NBC 26.